Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. Renal colic is a pain that comes in the back, and usually it's very intractable, and usually the patient goes to the hospital with a severe pain, and of course some of us had this pain and experienced this very hard moments. Today we're talking about the renal stones and their effects and how can we treat them. So we have with us today is Dr. Muhammad Hatim, consultant of neurosurgery. Welcome, Dr. Muhammad.
Welcome, Dr. Ahmed.
Renal colic is a very painful thing.
Renal colic is one of the most annoying situations for patients.
When you're in the emergency room, and usually you can diagnose the patient with a renal colic. You see him in a severe pain, in a severe agony.
Sure.
And
the patient has a very intractable pain.
Mm-hmm.
The patient can do anything to get rid of this pain.
Mm-hmm.
It's really intractable pain and very annoying situation.
Yes, definitely. But what are the most common causes of this pain, the renal colic?
Anything that causes obstruction in the urinary tract, all through the urinary tract, can cause this renal pain.
Yes.
Like stones, the most common,
mm-hmm.
Blood clots,
yes.
Tumors, all this can cause renal pain.
Yes.
Another thing that causes renal colic or renal pain, but it's not so severe, but we usually see it in our clinics, is hyperuricemia. Passing of urate, amorphous urate, or other crystals through the urinary tract can cause renal colic.
Yes. So if we want to talk about the stones, which you said that's most common cause of the renal colic, what are the stones? Because this is the most commonly heard about. You have a stone in the ureter, you have a stone in the kidney, you have a stone in the bladder, and people would wonder what is the stone.
The stone is the aggregation of crystals, either calcium oxalate, amorphous urate, phosphates, whatever these crystals are, on a nidus, and it's variable in its size.
Nidus is like a nucleus of the stone.
Usually it's a bacterial infection.
Yes.
It did bacteria, crystals aggregate on it and form this stone.
Uh-huh.
That's the stone.
Yeah, so there are many types of stones. I mean, you said there's sometimes calcium stones, there's sometimes the oxalate stones. What determines which kind of stones happen, and how different are they, one stone from the other?
Some stones form due to pathology, certain pathology.
Mm-hmm.
Metabolic disorders like hyperuricemia. Some forms due to genetic defect, like cystine stones.
Mm-hmm.
Some, like struvate stones, are formed due to infection, and this usually occurs in women.
Mm-hmm.
But usually the main cause of renal stones formation is idiopathic.
Yes. So to give an idea about how the stone forms and where does it form, usually it forms in the kidneys, of course.
Not all the stones.
Not all
Most of the stones form in the kidney, and they pass through the ureter. Either they are arrested in the kidney itself, in the renal pelvis, in the ureter, all through its course, or in the bladder.
Yes.
As we see in this picture,
yes.
You can see this is a picture of stones formed in the kidney,
mm-hmm.
and this is after its treatment how it passes through the ureter.
Yes.
So the stones can be formed, can be found at any place in the urinary tract.
Mm-hmm.
It's usually formed in the kidney, except the urinary bladder stones. Usually the urinary bladder stones, when it is larger stones, it had a certain another pathology. It's formed due to pathology in the bladder itself.
Yes.
Like neurogenic bladder, like prostate, it's due to aggregation of crystals on a residual urine.
It does not start in the renal canal or the renal calyces.
The small stones start in the renal canal, of course. Yes. So it passes outside through the bladder and the urethra. Yes. But larger stones, when you found a larger stone in the bladder in the patient, he has a pathology in this bladder.
Yes. So somebody would tell you, what did I do to have a stone formed? You already mentioned some of the causes that would lead to formation of stones, but somebody would ask you, was it something that I did wrong? Is it going to happen to me again? All these questions that you have about the formation of stones.
You know, Dr. Ahmed, nothing could predict.
Yes.
Nothing, either familial, genetic, metabolic disorders. All this is associated with renal stones. But many patients have renal stones and there is no certain cause.
Mm-hmm.
There is no definite pathology for formation of the stones. I can tell this patient will not have stones. I can say this patient will have stone.
Yes.
This patient will be stone former. But there is nothing to say this patient will not have stone.
Yes.
That's it.
So somebody has a pain in the back or the loin, as we say, and they would predict that they have a stone. How would somebody know that he or she really has a stone?
First, the patient has experienced a renal colic.
Mm-hmm.
He will goes to the emergency room, start to have analgesic, then we start examination of this patient, history of this patient, either he is stone passer or not, either he has experienced this renal colic or not. Then we start investigating this patient.
Yes, but first, does it has to be all the time starting with a renal colic?
Not all the time.
Not
Sometimes
all the times.
there is silent stones.
Silent
Stones.
Yes.
Some patients we found accidentally renal stones during our investigations for recurrent urinary tract infection,
Mm-hmm.
for presence of either microscopic or macroscopic hematuria. Microscopic
Mm-hmm.
means we found it in the urine analysis. The patient don't see blood in his urine.
Yes.
Macroscopic, the patient came complaining of having blood in his urine.
Yes.
So not all the patients with renal stones come with renal colic.
Yes, and the degree of pain should not reach to a colic, so that the person should go to a doctor. If they have some discomfort or a moderate type of pain, they should be referred to a urologist to examine them and.
As we said in the first question, obstruction in the urinary tract cause renal colic.
Yes.
Not stone in the urinary tract.
Uh-huh.
The stones that cause obstructions cause renal colic, this severe renal colic. The pathology of renal colic simply, we have the stone passing through the ureter, so it's arrested at any place of the ureter.
Yes.
When the stone is arrested, the ureter is like a tube.
Yes.
You can see in the first picture,
Yes.
the ureter is like a tube.
Yes.
So when the stone stops in this tract, the kidney doesn't stop functioning.
Yes.
So still there is urine coming out of the kidney,
Mm-hmm.
is arrested at the stone site and cause back pressure for the kidney.
Exactly.
This is what causes renal colic.
Mm-hmm. Mm-hmm.
So some stones don't cause colic. Bladder stones don't cause colic.
Yes.
Renal stones in the lower or middle calyx, not in reaching the renal pelvis, not usually causing colic.
So how would a bladder stone present?
Usually we found it while the patient is complaining of other symptoms.
Yes. Like.
If it is a small stone pathing,
Mm-hmm.
it may found that the patient, while micturating, had arrested his micturation. Suddenly.
Oh, that's
It's a typical picture of having small stone passing through the posterior urethra.
that should be very painful.
Very painful. The patient is retained.
Yes.
Other stones, larger stones,
Mm-hmm.
other stones and larger stones, we have it just when we are investigating for prostate, for having recurrent urinary tract infection, for having hematuria, irritative symptoms, regarding the bladder stones.
Mm-hmm.
Other stones, we start to do other investigations. As we see in this picture, this is a picture of stereovate stones.
Yes.
Okay,
Mm-hmm.
you can see in these pictures, it's having any shape. It's having any shape.
Yes.
In the third
Yes.
picture, this is the bladder stones.
Yes. The next picture shows the.
The blood. This is the second picture.
Yes.
This is showing stereovate stones.
Uh-huh.
It's found in the kidney. It's having any shape.
Yeah.
The next picture, it's having bladder stones. You can see all these stones are formed in the bladder.
Yes.
This patient is having PPH, prostate, he is complaining of prostate, and he is not complaining of renal colic at all.
Yes, that's a huge one.
Yes.
Yeah.
There are 4 stones.
Yes.
Then we start to investigate the patient. We usually do ultrasound and plain X-ray. This is the first simple investigation, and urine analysis, of course.
Yes.
If we found a pathology in the ultrasound or in the X-ray, we start to do more investigations. Usually the ultrasound finds stones in the kidney and in the bladder, not in the ureter. The ureter is small.
Yes.
If there is no
too narrow to show the
too narrow to be showed by the ultrasound.
Exactly.
If it's dilated, when it had the stones for a long time, more than 1 week or 2 weeks, it starts to dilate. So the ultrasound can see it.
So the size of the ureter can change by time.
Yes.
If the obstruction is
This is what we call hydroureter. The ureter is dilated.
And the patient would have still going doing his urinary output because
Yes,
the other
because
kidney
the other
is functioning.
And the obstruction is not usually complete obstruction. It's partial obstruction. When we do IVP for the patient, for example, we found the dye is passing beside the stone and completing the other ureter. So it's not complete obstruction. Sometimes it's partial obstruction. That's it.
Yes, we have a short break, and we will come back to see the more about the investigations for the renal colic and the urinary stones. Brothers and sisters, we'll be going out for a short break, so please stay tuned. We'll be continuing, inshallah, after the break. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back. We're still talking about the renal stones and renal colic, and with us today is Dr. Muhammad Hatim, consultant of neurosurgery. Dr. Muhammad, we were talking about the investigations you would do for somebody you expect, or you're investigating more the renal stones.
Yes, we said we do routinely ultrasound and plain X-ray.
Yes.
If there is a pathology, we start to do more investigations.
Yes.
There are 2 investigations we can do for patients having obstructed urinary tract. Either intravenous pylography, where we use a dye, we inject it intravenous, and is secreted by the kidney and show the collecting system. Many people has bad experience with the intravenous pylography.
Why is
Many
that?
people complain of having allergy to the dye, and some people died from intravenous pylography. They have severe allergic shock, and they cannot be go to the casualty or something like that. Now the dyes are ionic dyes. They cause no sensitivity.
That's good.
More investigation.
So this is a relief, because some people would be afraid of a bad history of somebody they've known earlier.
Many people, when I ask for IVP, intravenous pylography, they said, no, I have seen many problems. Many people say it's a bad experience.
Yes, that's true.
Now it's not a bad experience. It's very simple. It's ionic dye, don't cause sensitivity. Still we have more, but it's more expensive, of course, safe investigation, which is the non-contour CT. The advance in CT nowadays shows, like we see in this picture, you can see here, this picture.
Yes.
You can see this is a picture showing CT and these bilateral renal stones. You can see it.
Yes, that's true.
And the other picture is showing an axial film of the other picture, please.
Yes. The next picture, yes. Ah, there it is.
This is an axial film showing stone in the upper kidney and stone, another stone, but it's not complete here, another stone in the ureter. So
Yes.
all the urinary tract is diagrammed like this. You
Mhm.
can see any small stones more than, we have cuts at 3 millimeter, and you can see any stones.
Yeah, very detailed here, and
Yes,
you can
see the kidneys,
Yes.
and the ureters are
Yes.
seen very well. You can see stones small up to 3 millimeters.
And you don't need a contrast for that.
No,
You don't need a dye for
contrast.
that.
No, no.
Yes, that's great.
That's great. But it's more expensive than IFB. But we usually mostly use this.
Yes. During our practice, sometimes when I order an X-ray for a patient for the spine, for example, and I find a small ureteric stone, or sometimes even in the kidneys, and the patient never gets to know about it except when he does the X-ray.
Yes, you're right.
People like this would you recommend that they should investigate themselves more, going to a neurosurgeon and have more investigation?
Yes, they should investigate.
Mhm.
Any stone should be investigated.
Mhm.
Nothing to leave the stone. The stone had a harmful damage to the urinary tract. If this stone is causing obstruction, after a while, if the patient leave it, it will damage the urinary tract.
Yes, because I hear this from many of the patients. They would tell you, if I have no symptoms with these stones,
Yes.
what would it do to me? What would a stone do to the patient or somebody who has a
Still,
stone?
it should be treated.
Yeah.
If the patient has, we should treat the stones whatever they are,
Yes.
either small stones or larger stones. No stones could be left.
They could lead to
Except
infection.
very few cases,
Yes.
we have small stone in the lower calyx of the kidneys, in the bottom of the kidney, silent stones with no medical treatment affection, we can leave it. But in the advances of medicine and surgical intervention nowadays, we shouldn't leave any stone.
Well, that takes us to the management of a stone, of a renal stone or a ureteric stone, or a gallbladder stone, or I'm sorry, the bladder stone. What's the management of such cases?
Management of stones is a very long issue.
Mm-hmm.
I'll try to summarize it for you,
Yes, please.
for people who are watching us, but managing of stones starts from medical treatment. With the patient, we try medical treatment for him. When the patient has small stones with no obstruction, don't causing hydronephrosis for the kidney,
Mm-hmm.
we can try medical treatment
Mm-hmm.
for 1 or 2 weeks. If still there is obstruction or the stone didn't pass, we have to interfere.
Yes.
We have variables of medical treatment, either causing spasms for the ureter, dilatation of the lower part of the ureter, anti-inflammatories. All this
Yes.
can cause expulsion of the stone.
Yes.
Then we can start managing of stones. Surgical management of the stones, mostly in the past, it was all by open technique.
You have to do major surgery to go inside and take out these stones.
Take even small stones.
Mm-hmm.
And nowadays, usually we face patients to do open techniques, very rare.
That's good.
All stones could be managed endoscopically.
It's very good.
Another issue is to manage it by extracorporeal shockwave. It's simply the patient lie on a bed, shockwaves pass through the stone, fragments the stone, and it passes. Not all patients can use this.
Mm-hmm.
We use it for stones not more than 2 centimeters, located in the kidney, the renal pelvis, the upper ureter, the middle ureter. Even we can use it in the middle ureter,
Yes.
but for stones not more than 2 centimeters.
And it just breaks down the stone.
It breaks down
and
the
then goes
stones
down
as,
to the
as like
stream of
fragments.
urine. Yes, that's good.
If the patient is not capable for as well, for extracorporeal shockwave,
Yes.
we start to do surgical intervention.
Mm-hmm.
Stones in the ureter can be managed ureteroscopically. Simply, we can see a stone in the ureter here, and you can see it.
Yes.
In this picture, this is a diagram showing this is cystoscopy, and we are inside the ureter, and this is a stone in the ureter.
Yes.
We reach it, we fragment it, and we remove it.
You break it down and then
we break it down,
you suck
either
it.
remove it, yes,
Yes.
a whole piece if it is small stone,
Yes.
or we break it down and remove it.
That's
We
good.
have advances in laser. We can use laser to fragment stones, and it makes like vapor.
Yes.
There is no fragments at all. We can use percutaneous nephrolithotomy for a stone kidney. We can use laser,
Percutaneous, you just insuate.
small, very small incision,
Yes.
and we enter by an endoscope
Yes.
to the kidney. We can reach all the stones in the kidney, mostly all the stones. We even for something horrible like staghorn stones. Staghorn stones, it means a stone filling all the kidney.
Yes.
All the kidney is filled with stone. It was a horrible operation in the past. The patient may lose his kidney or even may lose half of his blood in
Yes.
this
Of course.
surgical
That
maneuver.
used to be when
Now
it used to be
it's
an
used
open
to be
surgery.
Small endoscopically surgery, and we fragment the stone and we remove all the fragments.
Yes.
Another way, we use laser in the ureter, in the bladder, in the urethra. All stones can be fragmented either by the pneumatic lysoclast, something like a small probe. It's entered and fragments the stone to fragments, and we remove the fragments, or vapor. It vaporizes the stone.
Very interesting.
There is great advance. So people who are afraid of having surgery for their stones, they shouldn't be afraid.
How long does it take for a patient to recover from such a surgery? Because that's, of course, a
For
question
example,
that your patients would be asking.
if you have a
after.
stone bladder and fragmented by laser,
Mhm.
next day the patient can go to his work.
To work?
Yes.
Yes.
If you have ureteroscopy, simple ureteroscopy, the patient can go out of the hospital the same day
Same day.
and go to his work next day or the day after.
Oh.
Still, we have in the percutaneous nephrolithotomy, when we enter the kidney, the patient should rest for
Yes.
10 to 12 days,
Uh-huh.
so as not to have secondary infection or something like that.
Still, compared to the open surgery,
Still
that's a
compared
great
to the other-
achievement.
Still, the patient, you can't imagine. I
Yes.
have a patient, he told me it's more than the Indian magic.
Yeah.
I've got out a huge stone from just 1 centimeter incision.
Mm-hmm.
So it's still incomparable to open surgery. But having a stone in the urinary tract, the patient shouldn't leave it. It may harm the urinary tract, or we may lose this kidney completely, and the patient, for something, the patient will cost him 1 day surgery.
So, by the end of the episode, it's very clarifying that you should not leave a stone in the kidney, even if it's a minute one. When you get stones, you have to go to a neurosurgeon, either to get treatment and get rid of this stone, or even if you have to go through surgery. Now, surgery is very safe. You do it with the endoscope. You don't have to go through a major surgery. And the recovery from the surgery is usually a very short period, and you can resume your daily life as after 1 day or 2 days after the surgery. By the end of the episode, I want you to give some advices to our audience how to try to, I wouldn't say to avoid, but try to avoid the formation of stones as possible.
Trying to avoid stones, first we have people who are stone formers.
Yes.
Stone formers should investigate themselves every 6 months, so as to having a small stones and passing early. This is better than going to surgical operations or something like that. Other people, normal people who don't have experienced stones, they should drink plenty of water,
Yes.
plenty of fluids, whatever the fluids are.
Mm-hmm.
If the patient have metabolic disorder, like hyperuricemia, like oxaluria, it should be treated. That's it. Another thing is to care of skin. Skin is getting rid of toxins, same like the kidney.
Mm-hmm.
So taking care of skin function is also an important issue. That's it.
Dr. Muhammad, thank you very much for being with us here today.
You're
Brothers
welcome.
and sisters, it has been a pleasure to have Dr. Muhammad with us today. I'm sure most of us have benefited of the show today. inshallah, we'll be waiting for your emails. It's health@huda.tv, and of course our website is huda.tv. Until next episode, we wish you a happy and healthy